Hi, today we're going to talk about reproductive health literacy in adolescents, and you're going to hear from myself, Sarah, Emily, and Emma. Okay. So here are a couple of our student learning outcomes. Go ahead and take a look at those. And this just really quickly is just a little extra thing. There's more information than we need, but this kind of tells us specifically that we're about 40% in the states of just like how well we're covering all sex ed, and 40%, if we're not even at 40%, it means we have a lot that we can still do. So according to the American Academy of Pediatrics, nearly 50% of adolescents are or have been sexually active at one point or another. And with that being said, it's important to educate clients in this age range of safe sex practices. Nurses are considered to be a trusted and confidential source of sexual health information. So it's important to have the information and establish an open line of communication without judgment. Honesty is critical, and so is providing privacy. The best practice for taking a sexual health history on adolescents is doing the assessment alone without the parents to help ensure accuracy. So to do this assessment, you want to use the 5 Ps from the CDC to help guide your assessment, and the first one being partners. How many partners have they had? Ask about a significant other. This might be a really good time to talk about safety in that relationship and talk about any potential pressures that they may have or feel. Relationships in adolescence can be important for assessing healthy relationship practices for their overall safety and well-being now and in the future. The second P is prevention. So how does adolescent practice safe sex? What kinds of contraception do they use? Do they use any at all? Are they abstinent? Do they have questions about prevention of STIs or pregnancy that are pressing at that time? The third one is protection from STIs. Do they use protection at all? Have they ever received the HPV vaccine? And if not, are they interested in talking about maybe getting it? HPV is very prevalent, which we'll talk about more later. Do they get screened for STIs or know where they can get screened? Number 4, what sexual practices, as in sexual practices. So what activities do they engage in? Different practices come with different risks. So that's anal, oral, or vaginal. So an example of this can be in the LGBTQ community. They have certain practices common in their community that are associated with a higher incidence of HIV/AIDS. So does each teen know the risks associated with the practices that they engage in? And the 5th one is past history of STIs and pregnancy. Do they have a past history? How long ago was it? What were the outcomes? And are they a teen mom? Do they need extra support, or do they need help preventing another pregnancy? So now we're going to talk really quickly about contraceptive selection. For selecting a method, there's just 2 distinctions to be made between perfect use and typical use. And this refers to the efficacy of each method. So perfect use is when it's like the efficacy rate. So using the method correctly, consistently, every time they engage in intercourse is what tells us what the perfect use would be. Typical use refers to pregnancy risk during the first year in the average user. It takes into account human error like a missed pill or not using a condom. So when an adolescent is in the clinic, they may need help finding the best contraceptive method that's best for them. And in order to do this, it's important that they have all the information of all their options so they can make an informed decision on what best suits their needs. Best practice in contraceptive education includes starting with teaching the methods that are most effective and easiest to use. And now Sarah, she's going to talk a little bit more about what each method is.
There are dozens of options out there for birth control. And they should all be chosen on an individual basis with the help of a healthcare professional. Contraception is often used in sexually active adolescents who are at risk for dangerous pregnancies due to their young age and development. Contraception can be obtained at your doctor's office, local Planned Parenthood, and many public health and women's clinics nationwide. Like I said, there are dozens of options out there, but we're just going to talk about some of the most common. So firstly, the implant is a thin bar that's inserted under the skin. It releases the hormone progestin into the body over a period of 3 years. It has a failure rate of 0.01%, so it is one of the most effective forms of birth control. The IUD, or intrauterine device, comes in a couple different forms. The non-hormonal form is a T-shaped plastic device that is wrapped in copper that is inserted into the uterus. The copper repels the sperm and causes it to swim in all different directions, and so that it cannot reach the egg. It can be used for up to 10 years, and it has a 0.8% failure rate. The LMG intrauterine device is the hormonal form of the IUD. It is T-shaped and flexible. It's inserted into the uterus, and it releases a small amount of the hormone progestin each day. It can be used for 3 to 6 years, and the failure rate is 0.1 to 0.4%. The risks with IUDs are that they can potentially dislodge and cause uterine rupture, and the same goes for the implant. That one can dislodge as well. Next, the shot. That's an injection of progestin into the buttocks or arm every 3 months at the doctor. It has a 4% failure rate. The downside of this one is that you do have to go to the doctor every 3 months to obtain the injection. The pill is a combined oral contraceptive of the hormones progestin and estrogen. It's taken orally at the same time each day, as a 7% failure rate. And the downfalls with this one is that it cannot be given to patients with clotting disorders, and it can be really hard for people to remember to take this every day, especially those adolescents. For our non-hormonal contraceptives, we have condoms. Condom is a thin sheath placed over the penis to prevent sperm from reaching the female body. It has a 3% failure rate. One of the great things about condoms is that they have dual protection for both preventing pregnancy and the transmission of STIs. But it's important to note that it's not 100% effective for either preventing pregnancy or the transmission of STIs, and best works when used in conjunction with other forms of birth control. Natural family planning is general fertility awareness that can be up to 99% effective when done correctly. It's very complicated, but it involves 3 different steps, and that is keeping track of the woman's menstrual cycle, keeping track of temperature, taking daily body temperatures, because changes in temperature can indicate changes in the cycle and ovulation. And thirdly, keeping track of changes in vaginal mucus, because changes can indicate ovulation. Lastly, abstinence, of course, is the only 100% effective method of both pregnancy prevention and STI transmission prevention.
Let's talk about STIs. STIs are commonly found in adolescents because they're unaware that they have an STI and tend to spread it to other sexually active teens, or because it's asymptomatic. The most common STIs found in adolescents are HPV, herpes, chlamydia, and gonorrhea. When we talk about HPV, it's the most common viral infection found in adolescents, but also found worldwide. There are over 200 plus strains of this virus. Some of these can be more low risk, such as type 11 and 6, which only cause genital warts, while others can be more high risk, such as type 16 and 18, which can cause cervical cancer. When talking about HPV, it's important to do preventative measures, such as just annual screenings and HPV testing. And there's also a vaccine recommended for women between the ages of 11 and 12. When talking about herpes, it is also a viral infection, but this one does show signs and symptoms. There's the herpes simplex virus 1, which causes oral sores, and then there's the herpes simplex virus 2, which causes genital sores. Some other symptoms seen in herpes is obviously the painful genital ulcers, dysuria, a fever, tender lingual lymph nodes, and a headache. It's not recommended with herpes to get annual screenings just because it's commonly found to have false positives. But you can take medications that help suppress the virus, even though it is a lifelong infection that you live with. When talking about gonorrhea, it's commonly found in women between the ages of 15 to 19. There's been an increase in gonorrhea from the years 2005 to 2008. It increased 21%. A lot of this increase is due to the fact that it's asymptomatic. This bacterial infection is commonly found in the throat, the rectum, the cervix, and the urethra. It has an easy treatment. It's antibiotics for about a week, but it's important to just be aware that it's asymptomatic, and that's why it spreads so easily. When talking about chlamydia, it's very common in the younger generation. It is, for the most part, asymptomatic as well. About 6 to 14% of adolescents show symptoms. These symptoms can include vaginal and penile discharge, burning while urinating, and just painful intercourse. To help with the prevention of chlamydia, it's important just to get tested regularly. But same thing as gonorrhea, it's antibiotics for a week for treatment. With all of these STIs found in adolescents, it's important to know that they can be treatable, and if not, they can be preventable. So when it comes to teen education, it's just important to educate them on signs and symptoms, and even if there are no signs and symptoms and they're sexually active, they should be tested regularly.
We were given the opportunity to interview Carl Straub, who is the health teacher at Helena High, as well as Deb Sargent, who is the school nurse, also at Helena High. When we asked about risky behaviors, they gave us about 7 of the top risky behaviors that they see in their school. These being social media, unprotected sex, substance use, abusive relationships, communication with their parents, and this could be their parents' communication with them is super open. They don't really have the conversation with their parents, and they still want the education, so they go out and they look for it. Or lastly, parents or the child themselves want nothing to do with sexual education, and so that can lead to a lack of access to condoms and birth controls, just the communication with the parents. And lastly, developmentally, this group of children, they don't really think of their consequences or their the future problems that happen because of these risky behaviors. Another question that we got to ask them is why they may think that some students don't go get help from them. And these reasons being, their parents are not okay with them learning the subject. So at Helena High, the parents are still given the option to pull their children out of the class if they don't want them being taught that. Sometimes the children are just embarrassed and they don't really want to go and get help from their school nurse or their health teacher. Or at the total opposite end of the spectrum, they may not have any idea where to get any of the information or the education. Finally, they may believe that they have no need to get more information, they know everything already and they don't need it. So these are some of the resources that are offered by Helena High School before and after problems have occurred. They are required to take a semester-long health course, and 3 weeks of this semester are related specifically into human sexual unit. Again, their parents are still able to pull their child out of that class. This class is taken hopefully as a preventative care, but if a mother does get pregnant or if a teen mom happens, they do have an area to go in the nurse's office where they are able to pump in a warm, quiet, and private space during school, and they have a place in order to store their breast milk as well. If the students come into the nurse with a possible pregnancy, the nurse can't give them a pregnancy test, but she is able to refer them to other places to get those things, such as Planned Parenthood, Options Clinic, or even just the hospital to confirm these results. So according to the CDC, here are some other statistics. There's about 18.8 children born per 1,000 women in the age groups between 15 and 19. This was a study taken in 2017. Out of those teen mothers, 50% of them will graduate high school and get a diploma by the age of 22, compared to the 90% of women who do not have babies will graduate high school and get a high school diploma. At Helena High in particular, they see this a lot where their teen moms may lose motivation, strive, or just lack of time management skills. This may lead them to drop out of school, and dropping out of school can lead to more health problems, to more time. You could have a possibility of being incarcerated at this point, and you also are being made or like forced to have unemployment during your young adulthood. Between 1991 and 2015, there was about a 64% drop in the birth rate of teen mothers. So this graph right here pretty much just sums up what I just said. Over here you have the amount of babies born per 1,000 women, which is that 18.8 number. This green was a statistic taken in 2016. So this is all races and origins. Over here, that goes more specifically into what races and what origins and breaks it down a little more. But as you can see from 2016 to 2017, there's been a little bit of a drop. Here are resources, and thank you for learning with us.